webinar series of Lux Innovation. Thank you all, and thank you, of course, to our speaker, Dr. Avery from the EIT Health Network. The aim of our webinar, so our series, is to provide insights and open a discussion around all the topics of innovation and development of healthcare technologies in Luxembourg. But also to discuss mentoring and funding opportunities at national and international level. The format of our event is the same as the previous, if you were already in our event, and it's a 30 minutes presentation from our speaker and 30 minutes interactive section. But we want to allow you to interact through all the webinar. So if you have questions, urgent questions during the presentation, please use the chat. After, when the presentation will finish, you can use the microphone independently and ask the question. So I ask you that during the presentation, you have your microphone closed, while when there will be the session on question and answer, you can open it. Don't worry, the session is registered, and to all the participants, we will send a link to the registration and the presentation. The focus today, as you know, you registered already, is the European Institute of Innovation and Technology on Health Innovation, that we call EIT Health, to shorten it. This is a very unique network that involves partners from business, research, education, and healthcare to foster innovation in these sectors, but also to support the big health-related challenges in Europe and worldwide, like aging and the digital transformation. The program of the network is very vast, and it's for all kinds of organizations, academia, big company, SMEs, and no-profit. And the special attention is given to innovative startups in healthcare. The network acts globally with a global strategy, but is built up through hubs. These hubs, each one of the hubs, cover specific country in Europe and beyond Europe. And today we have, in fact, Dr. Hayley Avery, who is part of the hub that covers Belgium, Netherlands, and Luxembourg. Dr. Avery, who is with us already, is the entrepreneurship lead at the EIT Health of this hub, and she has background in material engineering from the university in Australia, and she worked several years before coming to Europe in fostering innovation and development in SMEs. And 5 years ago, if I'm not wrong, Dr. Avery joined the EIT Health, and now she's really responsible for engaging companies like you and research center like you in all EIT Health programs. So I think my presentation, my introduction can stop here, and now I will give the floor to Hayley. Thank you, Hayley.
Thank you very much, Francesca, and thank you also to Lux Innovation for the opportunity to present EIT Health to you this afternoon. It's a pleasure for me to be here, and I hope that you find this useful and informative, and happy to also answer questions once the presentation is finished. Francesca already gave a very good introduction to EIT Health, but just to reiterate that EIT Health is a network organization based here in Europe, and our network consists of a vast and vibrant community of world-leading health innovators. And we are in part co-funded by the European Union and have been in existence since 2014. And what we are doing is collaborating across borders to be able to connect the brightest minds from business, research, education, and healthcare delivery, because what we believe by doing this is that we can have a more conducive environment where innovation can flourish. And indeed, we are aiming to address some of the biggest challenges that are faced by Europeans in health today. So how we see ourselves is that we are a facilitator or a catalyst that brings together partners from various sectors of healthcare to make innovation in healthcare happen. Francesca also touched on the fact that there are many challenges that we here are facing in Europe with regards to health, where innovation could potentially help solve some of these challenges. What we see, of course, is that the population is aging, and there are health issues that are associated with this. There has also been, of course, an increase in infectious diseases, pandemic threats, and also antimicrobial resistance that has presented challenges of course, we have all experienced recently. Chronic diseases are the leading cause of mortality in Europe. Most mortality is linked to non-communicable diseases, and we should be able to see how we can alleviate some of the issues associated with this. And of course, we are seeing challenges with rising costs in healthcare, alongside spending constraints, but also reduction, say, or challenges also with resources, the availability of healthcare professionals to deliver these healthcare services. And there are also social and healthcare systems that are being challenged in recent times as well. So our mission as EIT Health is to drive healthcare innovation and create positive societal impact in Europe. And to achieve this, we facilitate innovative solutions that primarily are promoting the better health of European citizens. This is really our ultimate goal. But of course, in doing so, we also want to strengthen the healthcare systems, increase their resilience and the ability to provide healthcare to the citizens, and also to contribute to a sustainable health economy in Europe. We are a truly pan-European network, and as Francesca mentioned, we have various regional offices, which we call co-location centres, that are supporting our partners across Europe. So we currently have 8 regional offices that are responsible for different parts of Europe, and as Francesca mentioned, I work for the Belgium-Netherlands office, which is supporting partners in Belgium, Netherlands, Luxembourg, and we also support startups in Israel. And we are very pleased to have University of Luxembourg as a partner in our network. But as you can see here, we have offices in various locations around Europe that are responsible for supporting the partners that we have in this part of Europe. Just to clarify that the area that we refer to as InnoStars, highlighted in yellow with the stripes. This is a larger network consisting of the countries that are on the edge of Europe, and we often have a number of very specific programs to support the developments in these regions as well. And we have a number of outreach hubs, one based in Silicon Valley in the US and another one in Tel Aviv in Israel, to support EIT and the broader EIT network in these countries as well. And as mentioned, we have world-leading organizations as our partners, coming from business, research, academia, and healthcare delivery, and currently have among 120 partners in our network from all over Europe. Some of the logos of these partners can be seen here in this slide. And it is important for us to have this network because we work together with these partners to be able to not only deliver the innovations to the healthcare sector, but also to develop new ways, new initiatives, new programs that will allow us to address some of the challenges that European citizens are facing with regards to health. Excuse me. So what is it that we are actually trying to do, and how are we trying to deliver these new innovations to the healthcare system? So what we see is that innovation happens when you bring together what we call our knowledge triangle. So this is business, research, and education. We are focusing on innovation, but with new innovations, you often need to have new skills. They may require retraining or educating the healthcare professionals of today and the future. So we also spend quite a bit of our efforts on developing education programs that allow us to provide these training opportunities. And we also work together with a lot of startups who are developing the new innovations and helping them to bring these solutions to the market in the most efficient way, to be able to deliver these solutions to healthcare professionals. So in most of the activities we are doing, we try to cover at least a couple of these sides of the knowledge triangle, but keeping in mind that we actually need to focus on all aspects to be able to achieve what we're setting out to do. So within EIT Health, we could focus on a lot of things. Excuse me. But we have decided to focus on 3 flagship initiatives that we believe address 3 of the greatest healthcare challenges that we are facing in Europe. Sorry, I've got a tickle in my throat. So first of these flagships is new model to deliver healthcare. Then we have the digital transformation of healthcare and the re-industrialization of Europe. So with regards to new models to deliver healthcare, what we see is that healthcare systems need to change. We cannot offer the same kind of services and support using the existing systems, and we need to think about how we can redefine the healthcare models to be able to implement strategies and work flows that deliver the needs that the patients are looking for. And we have built this around what is called value-based healthcare, where there is a focus more on patient outcomes rather than just transactional type treatments. And as a result, we're shifting from treatment to prevention. So we're looking at initiatives that help us to achieve these new models to deliver healthcare. We also have the flagship under the digital transformation of healthcare, and we see that there's a shift towards digital healthcare that can improve the efficiency and effectiveness of medical services. And in this respect, we are looking at 2 aspects of digital health. So it's the development of and access to digital health medical devices. So think about apps and other kinds of patient-centric type tools that where the patient can also have a more empowerment over their disease trajectory. And also we're looking to implement the European health data space by exploring the secondary use of data for innovation as well. And our 3rd flagship is on the reindustrialization of Europe. What we saw with the COVID pandemic is that the vaccines were developed offshore or manufactured offshore, and we want to bring some of these kinds of activities back to Europe. So this flagship focuses on equipping Europe with a strong, innovative and export-friendly healthcare industry while developing lasting and innovative European manufacturing capabilities. This program is, or this flagship is linked to the important projects of common European interest, and so we are largely relying on these activities to trigger things that we will do within EIT Health. So I will not talk much more about this today, but hopefully in the near future we will be able to share more details of what we as EIT Health will be doing within this flagship as well. So within these flagships, we actually have just launched a call for new activities under the flagships. The call was launched last week, so it's just hot off the press. And we have the 2 flagships that we are focusing on for this call, where we are calling for a number of different activities. So the activities highlighted here in green are education-related programs, and the ones that are highlighted in pink are more innovation-focused programs. So within these technology and service development activities, or our innovation type activities, we're calling for 3 types of projects. The first is service development projects, which promotes the market uptake of innovative products and services by assessing the quality of the healthcare service improvement. So these types of projects are very much linked to new models to deliver healthcare and focusing on value-based healthcare that it can deliver to the patients. The technology development activity is falls under the digital transformation of healthcare flagship, and these are collaborative projects led by SMEs or industry partners that focus on the validation, certification, and market access of digital medical devices. And we also have a Dig Innovation program, which will be calling for projects later in the year, which is focusing on accelerating the uptake of digital health apps and helping these startups with the market launch and reimbursement processes for these health apps. For our educational activities, we have 4 types of programs that we're calling for projects. First is our innovation days, which is hackathon-like events that provide training in innovation, entrepreneurship, design thinking methods, and pitching. We have our master's degree program, where we collaboratively design and implement a 30 ECTS program of educational content in innovation and entrepreneurship. And we have various modules that we're developing, first for a labeled fellowship program. So these modules can be mixed and matched by the learner, and focus also on innovation and entrepreneurship, as well as flagship related courses specific to the flagships. And as a learner, you can combine the courses to develop your own fellowship program. And we also have modules towards EIT labeled certification. And there are 6 new courses in digital transformation in healthcare that will be offered online via our EIT Health Academy. So as mentioned, I forgot to add the URL. As mentioned, we just launched the call for these projects, these activities, and there are a number of conditions or specifications for each of the programs. I won't go through all the details here, but as you can see, there is different grants available for each of the programs, that the programs also run for different durations. The main thing to note is that the first deadline for these programs is the 28th of February, where depending on the program, it's either the submission of a short proposal or a full proposal. For the innovation type projects, it's a short proposal, so that we expect at this 28th of February deadline. And as mentioned, we will be calling for projects for the Dig Innovation program later in the year, with the deadline in September for this particular program. So if you have a project idea that you would like to discuss with us, that is most welcome, and we're happy to help you to think through your project idea together. The best way for you to contact us is through our info@eithealth.nl email, or you can also contact me directly, and we can make an appointment to discuss your idea further. So we have the flagships program, but it's not all the only things we are doing. As mentioned, we have this knowledge triangle where we are focusing on innovation, education, and business creation. So we also have opportunities for startups and scale-ups to basically initiate and launch your company, but also to grow your company as well. So actually, just as of yesterday, we have launched a few programs within our business creation portfolio. At the moment, we have 4 boot camps that we are accepting applications for, and I will briefly present each of these boot camps now. So the first one I'd like to mention is our Women in Entrepreneurship boot camp. The focus of this boot camp is really to support companies that are either founded or co-founded by a woman or has a woman in one of the leading positions that are at an early stage. And we help to connect these companies to our network of mentors to be able to nurture and grow these companies. There are not many health-related companies that are led by women, and we also see that many of these companies struggle compared to, say, companies that are led by men. And so we've developed this specific bootcamp to kind of give the extra support that female entrepreneurs could benefit from in running a healthcare related business. We also have our patient innovation bootcamp. And basically this bootcamp came about through the fact that many innovations actually come from patients and their caregivers. They have the first-hand experience of what it is to suffer from a specific illness and disease. So it makes perfect sense that they may have ideas to help alleviate the symptoms or improve the disease trajectory based on their own experience. So this bootcamp supports the development and launch of innovative solutions that have been created by the patients and caregivers who are directly affected by the health condition. And I think this is a really nice bootcamp because it shows how some of the simplest innovations can be brought about just by thinking through together with the patients and recognizing that the patients should actually play an important role in healthcare innovation as well. Our next bootcamp is the MedTech bootcamp. This is focusing on MedTech companies, so both medical devices and digital health startups primarily. And this bootcamp gives you a chance to get a clear and valid proof of your concept so that you can launch your business onto the European market. And it focuses on what it is to run a MedTech bootcamp, what are the regulatory requirements for medical devices, how you can go about being reimbursed for your medical solution, and how to think about financing in general and running a medtech type company. And our final bootcamp that we have on offer is the Regulatory Pathways to Market bootcamp. This is also focusing on digital health and medical devices, but really focusing on the regulatory aspects for these types of companies. And the difference between, say, the MedTech bootcamp and the Regulatory Pathways bootcamp is also regarding the stage of the company. So the MedTech bootcamp is open to very early stage companies, while the Regulatory Pathways will focus on those that are just about to embark on the regulatory process. And through this bootcamp, the startups will receive support in navigating the healthcare regulations so that they can prepare for their entry into the market. So the bootcamps, as I mentioned, are open now for applications, and I will show you in a minute the deadlines for these. If you have questions about the bootcamps to see whether your company would be a good fit for these programs, you can reach out to me and I'll be happy to discuss this further with you. And then I just wanted to present a few other programs that we currently have running or about to launch. So at the moment, we also have a program focused on open innovation, which is a challenge-driven program that aims to bring together both industry partners and healthcare providers together with researchers or startups who have solutions that could potentially solve some of the biggest healthcare challenges that we are facing. We currently have a challenge that we have defined together with KU Leuven and Takeda in Belgium that is focusing on a way to monitor patients who have inflammatory bowel disease to detect inflammation and potentially to mitigate the onset of inflammatory flares. Unfortunately, the deadline for this program is tomorrow at 5 o'clock, so I didn't provide a lot more details here since the deadline is very short. But we are launching new challenges soon, so we are currently working on developing, together with partners across Europe, 2 more challenges that we will be announcing shortly. In this program, it's also an acceleration program, so it will give you the opportunity to fast track the implementation and procurement of your health solutions, and you have the chance to collaborate with partners in our network, such as KU Leuven and Takeda in this case, to really understand better the healthcare journey from both the patient and the healthcare provider's perspective, and see how you can implement your solutions in these trajectories. And we also have another program that's more focusing on scale-ups. It's called Catapult, which is a training program and a competition that boosts the development of top-notch European health startups in life sciences and health tech. And how we do this is by exposing these startups to leading experts and investors. And it's, as mentioned, it's a competition, so it takes place in rounds of pitching sessions, where in between these pitching rounds, you also receive mentoring and support on how to refine your pitch, how to improve your value proposition. And the ultimate goal is to also create more visibility and exposure of these companies, ultimately hope with the goal that they will be invested in a more timely fashion. And as mentioned, this program is open to health tech startups and life sciences startups. And I heard a whisper the other day that the new call for this program will be opening in a couple of months. So please keep an eye on our website for more information. So as mentioned, the boot camps are currently open for applications, and the deadline for the Women Entrepreneurship Bootcamp is the 25th of March, while the deadline for the other boot camps is the 21st of May. The Open Innovation Program that we currently have open is closing the deadline tomorrow, but as mentioned, new challenges will be launched soon, so stay tuned for these. And we hope to announce a new call for Catapult in the coming months as well. Aside from the flagships and the business creation programs, we also run events throughout the year, and I wanted to highlight a few events that are coming up. First of all, linked to the flagships, we have our matchmaking event that will be held on the 7th and 8th of February in Lisbon. So if you have a project idea and are looking to connect to partners to form your project team, this is a perfect event to attend. And there's also various inspiring and informative sessions, networking opportunities, workshops, and it's a great way to get to know some of the other partners in the EIT Health network. And it was a great pleasure to actually host the EIT Health matchmaking event in 2022 in October in Luxembourg. So if you speak to some of the people who attended that event, you will have some idea of what it's all about. And if you're interested in attending, please check out the website. But if you'd like more information, you can also reach out to me. And we also have our EIT Health Summit, which this year will be taking place in Rotterdam, in the Netherlands, from the 18th to the 19th of April. And we have focused on this year's event on the theme about taking action to create change. So moving the dial from thinking to doing and creating long-lasting impact in healthcare. And to do this, a strong change management strategy is needed. So we want to learn from other industries that have gone about change, and seeing how we can implement similar changes in healthcare as well. So this event will be 2 days consisting of keynotes, presentations, but also a number of workshops. And it's open to anybody as well. So if you would like to attend, please check out the website. And if you are a startup and would like to join, I can offer you a discount code as well for the reduced registration fee. So please let me know if you'd like to join, and we can see if we can arrange something for you as well. So I hope this gives you some insight into some of the things that we have on offer at EIT Health. But maybe your other question is, well, what has this led to since 2014? So over this time frame, we have supported more than 2,500 startups, and these startups have attracted 1.9 billion euros in investment. So this is really fantastic. Through the various innovation programs, we have been able to launch 113 healthcare products and services on the market to address unmet health needs. And we have also been able to support 363,000 citizens and patients who have benefited from these new healthcare solutions. And almost 50,000 students and professionals have been trained through our educational activities as well. So if you would like to learn more about the programs that we have on offer, the things that we have been doing, I didn't go through everything here today. We are also involved in other activities such as think tanks and various other projects, also together with partners across the European Union. You can find more information on our website, and then for specific activities related to the flagships, we have a flagship hub page on our website. The Our Programs page lists all the business creation programs that you can apply to, and also the education activities that are open for students to register for. We also have our social media pages on LinkedIn and Twitter, and you are also most welcome to subscribe to our newsletter, where we share regular updates of things that are happening within EIT Health. And I also send out a startup-related newsletter, which also gives more information on other activities that could be interesting for startups within the region as well. So EIT Health aims to bring about new innovations in healthcare, and we're very happy if you would like to join us in helping us achieve these goals. So please do not hesitate to contact me, or if you have questions now, I'm happy to answer them. And yeah, hopefully we can bring about some changes together as well. Thank you very much.
Thank you, Hailey, for the presentation. And was very, as you said, it's not covering, even if it was very big presentation, it doesn't cover all the activities that EIT Health provides and ideates. So not only Hailey gave us a presentation, but as you heard, she's available for all your questions, either now or in the future. You can contact her, you can contact us, and we put you in copy. So she's really here for you. We have a couple of questions, quick questions. For example, Eva, I don't know if you want to unmute yourself and ask the question, or should I read you here? I can start. She was wondering why some countries like Bulgaria are not in the EIT Health. You know, there is a special reason.
I mean, we don't have a specific office in Bulgaria, but we still support innovations coming out of Bulgaria. We don't have any partners specifically at the moment there, but we do see that we have startups coming from Bulgaria and other Eastern European countries as well. And our programs are open for all European based organizations. So if you're incorporated in Horizon Europe country or associated country, you can participate in the various programs that we have on offer. And yeah, even though we don't have a representative in Bulgaria, we have people supporting this part of Europe as well, so we can help to put you in contact with those people if you want to reach out to them.
Another question also interesting from Eva was about the consortium. So there are some programs which can be mono-beneficiary, so from single companies, but there are others which will require a consortium. Can you elaborate a little bit on this?
Yes, so indeed, many of our projects require a consortium, and actually we even have other specific requirements that to involve at least an EIT Health partner in the projects, and also if you apply to an innovation project, you should have partners from different regions within Europe. If you need help in connecting to partners, we can help to make introductions. It's very useful, of course, for us to have some idea, like the type of partners specifically that you are looking for. But we do this all the time, that we ask around to our colleagues if they know of someone who would be interested to collaborate with you on your projects. And also with the matchmaking event is a good opportunity to connect to other partners from across Europe to help build a consortium as well. So, but yes, we're happy to facilitate introductions and make connections to help you in building your consortium.
Before going to the next question, I will ask you something related to the matchmaking. As it is very soon, is there opportunity also to do online matchmaking, or it's only physical this time?
That's a good question. It may be possible to do there's an opportunity to have one-on-one like matchmaking sessions, so at one-on-one networking meetings. It may be possible to do those online. The other sessions, such as the lectures or the workshops, they may only be offered in person. I'm not 100% sure, but I would. That's how I think it probably is for the moment. Yes.
So better to check the platform and see what are the opportunities. And then there is a question on something, okay, you didn't touch today, but about the user validation labs. Do you know if there will be a new call on that, when it will be a little bit the timing of this?
Yes. At the moment, we are not sure about how we will continue this specific program. So at the moment, there is no plan for a new call for this program. And it may be offered in a slightly different package as well. So my colleagues are currently working on this. So I would suggest, if there's a specific interest in this program, you could let me know, and then I will make sure that once we have the information, I can share it directly, or otherwise keep an eye on the website as well.
You said that there are already several offices of the EIT Health also outside Europe, that you can connect also in places where there is no in Europe where there is no office. But what about, someone is asking, African countries? Is there any agreement? For example, they really mentioned the European Union Digital for Development Hub with the African countries.
Yes, we do not have any formal relationship with African countries. So at the moment, also we do not offer any programs or opportunities to collaborate with African countries. But EIT Health is opening up, so we are expanding the partnership and the people that we will invite to the network. And so maybe in the future, we will also have an opportunity to bring in African partners from Africa as well.
But in general, under Horizon Europe, all the African countries can participate because they are with a low income. So maybe this would apply for most of the programs where consortium are required.
I'd have to double check.
Okay.
But yeah, normally we say Horizon Europe countries and those that are associated. I don't know, for example, for the specific requirements for the African countries, I must say.
Okay. And another question is about mental health. As you know, it's there is a lot of around this topic in these last months and years. Is there will be something specific on mental health in IT Health, or people that are in this field have to apply to the same goals that you have?
Yes, so we of course are open to receiving applications from different health disciplines. So and mental health for sure can be one of the topics there. We don't have anything specific at the moment, but EIT Health is involved in the European program on personalized medicine, and maybe we see more of these types of activities coming up in this program, for example. And we are launching new initiatives all the time. For example, the Open Innovation Program. This is very much challenge based. So if we see that there is a challenge in mental health that we should try and address, then that may also be a topic for there as well. So nothing at the moment, but indeed it's something that, of course, is very important for us to cover and keep an eye out on the opportunities in the future where we may have a specific program as well.
There is another very interesting question is about the core partners. So maybe here it's how you work with them, and do they provide you a list of challenges, problems that they want to solve? And is it possible maybe to discuss with them or doing potential pilot with these the core partner, let's say the pharma or the medtech big players?
Yeah, so indeed, sometimes we hear from core partners about certain things that unmet needs or certain challenges that they're trying to address. For example, in the Open Innovation Program, this is one way. We don't really widely advertise these things, but if there's a program specific like the Open Innovation, then of course you will hear about it. If you think there is something that you can contribute to another partner, it's also fine for you to reach out to us and say, this is what we're offering. Do you know people that are looking for this type of support? So we specifically for startups, we see that, of course, that's more difficult to make these connections. So we're offering our support in helping to introduce startups to our core partners as well. Otherwise, yeah, the matchmaking event is also a good opportunity to hear about some of these challenges as well. There will also be a specific session where partners will present the project ideas that they have as well. So then you can also get some idea of the types of unmet needs and challenges that they're looking to address.
I don't see any more questions on the chat. Is there anyone that wants to take the floor? You can unmute yourself now and ask if you have other question for Hailey, who is here today. And of course, as we said in the chat, we will give you her details in the presentation, so you will have all the contacts. Any other question? I don't see any, but I have one. Yes, there is another question. About cybersecurity rules. Do you also work on, you think that there might be technology interesting for IT health projects which deal with cybersecurity, and I think then cybersecurity and medical device is kind of link. Or cybersecurity, or also maybe the people here are interested also in anonymization, pseudonymization. Is IT Health also interested in this kind of application?
Yes, indeed. Also, for example, we're quite actively involved now in a number of projects related to AI and also the issues regarding sort of ethics and the like associated with this and the risks. We are connected to the European Health Data Space, and of course, issues regarding interoperability of data, but also the ensuring the anonymization and confidentiality of patient information becomes critical for these kinds of aspects as well. So we are involved in various programs or other activities looking into this, but we don't have specific calls on this topic, but we sure are aware of these kinds of risks.
It can be part of a project, a proposal. Of course, maybe it's not the main focus, but it's part of the solution developed.
Yeah.
Okay.
Yeah.
And there is a last question, I think, on is there any specific initiative or opportunity with Ukraine?
We have had some in the past. I don't know of any at the moment that we have open. For sure, a few years ago, we launched calls for supporting innovators and researchers and healthcare professionals in Ukraine. I know that because in general in Eastern Europe, there's a strong focus on really helping to develop innovations in these countries. So yeah, there's always opportunities opening up. So yeah, please also keep an eye on the website because most of the opportunities are announced there as well.
Okay, good. Any other question for Hailey now? No, I think it's complete. Maybe the very last, if I can, because you know we have a lot of startup in our ecosystem, and I think the bootcamp can really help them to strengthen their position. But what is the best approach to understand which is the right bootcamp for you?
That's a good question. And I should have mentioned that there are webinars planned for the boot camps. So these webinars are run by the partners who are actually delivering the boot camp. So then you also have the opportunity to ask specific questions about whether you're suitable for that boot camp or not. You can also contact me. I'm happy to discuss with you what kind of startup is your company, and see which one would make the most sense, because we do have some requirements for each of the boot camps. So I think these are the main ways to learn more about which one would be the best for you.
Okay, so very good. So maybe in the email we can then also inform about that there will be this webinar that will be now announced on your website.
Yes.
Okay, perfect. Okay, then I think the QA session can close here. There are no additional questions. Thank you so much, Hailey, for your presence, all the presentation, and also very for the session and your availability to continue helping Luxembourg ecosystem. And thank you for all you participating in the webinar. I hope you are now better informed about the opportunities of the EIT network. And of course, we are available to give you more information. Something now about the Luxembourg Health Tech Cluster for the next months to come. So the next webinar is in February, on the 28th of February, and as usual, it will be at 1 p.m. Next webinar, we will host Medical Valley Ecosystem from Germany, Nuremberg. And they are an ecosystem already well established, and they will show us which are the best practice to for a fast and fruitful interaction with the stakeholders. And then don't forget that also with the EIT Health support, we have our digital medical device conference coming in May, 14 afternoon and 15 in the morning of May. So already book your agenda for this. It will be in Luxembourg, and it will be the second time for the one of you that participated already last year. This will be a new one. Of course, follow us on not only the EIT Health work, but we have the Health Tech cluster on LinkedIn, where you are informed of all the opportunities and all the events that we organize. I think that there are no more, no, there are some people that thank you, Hailey, and we thank you again. Thank you very much. Have a nice continuation of the day. In the afternoon, most of us are at home today, Hailey, because of the icy roads. But okay, we continue work, and yeah, I wish you all a very nice afternoon.
Thank you also again, Francesca, and to the Lux Innovation team for this opportunity. And thank you for everyone attending and for your questions.
Thank you.
Thank you very much. Bye.
Bye.